thank you for being here. And today we have, the plan is to have a nice discussion, open-ended discussion. And we have three of our esteemed members here. I'll let them introduce themselves. Stephanie, if you want to go first, and then we can just kind of go this way. And by the way, I'm Aditi Gopendo, Associate Director for Frontiers, and I have Lisa Cox. Lisa, you want to introduce yourself?
And I'm the Associate Director. We'll get there. But our really important panel members are our external advisory committee, which we're so happy to have here. Shall we start on this one?
Yeah, so afternoon, I'm Stephanie Miller Hughes. In addition to what you see up there, I'm also I'm from Harry Medical College, but I'm also the site PI for the Vanderbilt CTSA, which is our equivalent to the Frontiers CTSI. And so this community engagement core that I lead is part of the program in health disparities. This is sponsored by the RCMI program through NIH.
Hi, welcome. I'm Clara Pelfrey. I am the Director of Evaluation for the Clinical and Translational Science Collaborative of Northern Ohio. Now, maybe even longer. We added, rather than just the hospitals and case and all in Cleveland, we've added University of Toledo, and we've added the Northeast Ohio Medical University. So, so we're branching out. We're not as branched out as you are here in Kansas.
I was gonna say, you're growing frontier-like.
Well, we're growing. Yeah, and as part of, I think relative to this, the communication piece with communities of interest, for me, is communicating successful translation. How do you do that? And so I'm sort of trying to do that with case studies.
All right. Hi, I'm Jenny Cross, and until very recently, like January, I was the director of the Team Science Core at the Colorado Clinical and Translational Sciences Institute. But in January, I left the university, so I'm now a professor emerita of sociology, and I'm heading up the co-creation and rural engagement processes in a very large NSF group.
And I was wondering if in our audience we can get a sense of who in the audience is from the community. We have some community advisory board members and some folks from our community. Who in the audience is a trainee? Is anybody in here? Okay. Who in our audience is in academic research? Okay. And who in our audience is in clinical clinical care or clinical sciences? Yeah, and multiple roles. Other roles that we have in the room, this is partly just to help our panel have a sense of who is in this conversation today. Any categories that we should add? Okay, so this is great. So we have a really diverse group. Yes.
So none above, none above.
Okay.
Which category?
No, I have a researcher, but another category that you can add is none of above.
So should we start a little bit about your research and then maybe talk a little bit about community engagement with your research, and then we can kind of go, take turns and then kind of start from there.
So my interest is specifically in diabetes-related health disparities. So my clinical trials are focused on finding evidence, translating evidence-based practices for African-American women with type 2 diabetes. So my current clinical trial, which is funded by PCORI, the Patient-Centered Outcomes Research Institute, is testing the added benefit of motivational interviewing added on top of medical nutrition therapy to improve diabetes outcomes, mainly A1C. And so that's been kind of my research interest since a postdoc. So this has started with a lot of formative work and finding out things that were important to African-American women with type 2 diabetes in terms of their outcomes, what things were the most challenging, and it was always diet. So that's why my work is now kind of, these clinical trials are testing kind of those that are related to diet and medical nutrition therapy. So that's an ongoing trial now. And the way that we have kind of engaged, so there's probably two different community groups we've engaged. So there's been community organizations and community health centers, right? So from the very beginning, we thought about translating, so whatever we find in this evidence base, we want to work with people who could actually implement what we find in research. So they've been partners from the beginning, so they're partners in kind of recruiting and implementation. So we also have kind of patient stakeholders, and I know that's not the right word anymore, but we do have patient communities. And so we've started this work probably 2013 and 2014. So I have African-American women with type 2 diabetes that were part of the pilot studies many years ago that are part of the advisory board. And we learned about hearing something, maybe they shouldn't be advisory, right? We should call them something else, but they have actually informed, you know, this study from the beginning. So we wrote the application, I worked with them on kind of, are these the right outcomes, like things that they, you know, wanted to see. They worked through kind of intervention, writing the grants, they provided their, you know, bio sketch for the application as part of the patient advisory group. And so now that the study, so we were funded, fortunately, and now the study's ongoing. When we started, they were very instrumental in, you know, I mean, one of them, like literally was also a graphic designer. She created the website imagery. So they've been involved in every aspect of the study. They've been involved in a couple of publications now. So I'll just stop there for now, but those are the two major groups, kind of the community-based organizations, including churches that have kind of helped share this, and then patients. So I'll stop.
Gary, you want to go next? Well, I discovered from the discussions this morning, the 10-minute speed mentoring, that really my current work was informed by some of my previous jobs. So I started out as an immunologist, microbiologist, studying the immune system in multiple sclerosis. For 20 years, I did research on that. And then I became a scientific review officer. And then thanks to economic situations in the US, I had lost my job and I became a science teacher in 7th grade. And that was a huge transition. Just getting your students to call you doctor.
How great.
But I realized that 7th grade science teacher in me loved learning to communicate the science to people who are not scientists. 7th graders are not scientists. And unless you communicate it well, they're asleep or something else, you know. So that communication piece followed me into my director of evaluation job at the CTSA in Cleveland, where everyone in the evaluation world, including even the heads of people at NCATS, were like impact. How do we communicate the impact of what the CTSAs do? And we evaluators were not doing that, right? We were, sometimes people call it counting widgets. How many people, how many consultations did we have? How many people came to our conferences? How many members of our cab, blah, 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 right? Things that didn't really matter to MCATs or to Congress for that matter. And Congress is the one who appropriates the money that's, you know, all of us live on basically in the CTSA world. So in 2017, a bunch of us evaluators got together and said the best way to measure impact is to tell impactful stories. But because we're evaluators, we have to do that in a rigorous scientific way. You can't just say, this is a great story, let me tell you about it. We have to be rigorous. So we realized a case study at that time was for most people, an interesting patient study that ends up in a medical journal. This patient was different than all the other patients and this is why, or this is why how we treated them or whatever. But a case study wasn't a successful story of translational science. So we said, well, we got to define what is a translational science case study? And so we wrote a protocol. How do you do a translational science case study? Rigorously, backed up by science, backed up by the evidence. And then where do you publish it? If you try to publish it in a medical journal, they go, this isn't a case study. So we realized there really wasn't a mechanism for publishing it. So we went to the Journal of Clinical and Translational Science. And JCTS agreed that they needed a new manuscript category. And so we gave them the definition, fortunately. And they accepted that, so they didn't have to do very much work. And they created a brand new category for a translational science case study. And of course, we created the protocol, we published that. And then we said, okay, now the hard work, now we all have to go back to our CTSAs and do one. And it turned out to be so much more challenging than we thought. To do that and to do it with rigor was a lot of work. And we thought we'll have 10 of them by the end of the year. And 3 or 4 years later, we had maybe 3. And I had one I had published in the JCTS. And we did realize just how much work this is. And we realized we needed a whole lot more of people working on this. How do you do that? Well, we thought the best way to do that was a working group, CCOS working group, they're called now. And we'll get a bunch of other CTSAs involved. And so myself and one other person, Debbie Diaz-Granados, we co-chair a working group for translational science case studies. It has a much longer name than that, but that's a good enough title. And now what we're doing is we have 30 other CTSAs involved in this, bringing in their case studies. And sometimes we get stories that aren't really translational science case studies of how someone translated something to humans. It might be how they did sort of a QI project within their CTSA and created a new way for scientists to get help doing translational science. So we've gotten a few of those and we realized, oh, maybe we weren't clear enough on what that is. But anyway, we now have over 50 case studies that we've accumulated. Not all of them are translating something to humans, but there's still stories that are worth telling. And maybe there's a whole new category we hadn't thought of, this sort of QI or develop new ways to help researchers at CTSAs. And what we're hoping to do is not just create all these case studies, but compare them all to each other. So a cross-case analysis and say, are there commonalities in the challenges researchers have had, the roadblocks, and how they overcame the roadblocks? That's the key piece for me for studying successful translation. By definition, they're successful. They got over the hurdles, right? So find out what those hurdles were and how they got over them and publish that. And then start comparing between cases. Maybe all the drug developments have similar ones and all the community research have different ones. So that's what we're hoping anyway. But we've been working on this since 2017. And we're still at it.
Can we ask questions when? Okay, what is your definition you came up with for translational science case study?
I can look it up. I can memorize it. Go to the JCTS website. Go to the management categories. Those are my words. I wrote them down. The one piece I did not insist on, and I should have, was health intervention. I just said intervention. That's why we started getting those CTSA QI studies, because it wasn't a health intervention. It was how do I improve my CTSA for helping researchers. So it is a study of something that improved something, but it wasn't a health intervention. And so then we started getting those and we're like, these aren't health interventions. And then we realized, well, they're important, but for a completely different reason.
I mean, we have a research team in my own department doing that non-health intervention type case study right now. So I kind of appreciate that you have it more broad than.
Well, and those you can do in a year or 2 or 3 and publish in JCTS, let's do, right? The translating to humans part, of course, the literature out there says it takes 18 years,
Yeah.
right? The very first case study that I did, it took him 7 years from inception and getting his pilot award at our CTSA to getting his thing regulatory approval, not in the US, because his device was for measuring sickle cell and he wanted to get it into low resource countries where sickle cell is endemic. and nobody gets tested and babies die. It's now in 42 countries. So it took him 7 years. So 18 is not always true. I'll shut up. It's your turn.
All right. Well, I am a community sociologist, and I spent my whole career doing community engaged research, thinking about the keynote this morning and the workshop. I was super privileged in my PhD program. We taught our students how to write to an audience other than academics. So in intro sociology, we taught our students to do ethnography, to go out and observe the world, to discover patterns in it. And we required that they write their paper at a level that their grandmother could read and understand. And so I feel really privileged to have been taught about how to speak to audiences other than academics and have taught others to do that. My very first job was as an evaluator for the local school district. I was a research associate for years, and that was the first thing that we had to teach everybody there is how to write evaluation reports for parents of high school students, right? We do these, the youth risk behavior surveys, and we give these giant notebooks to every school, but then we had to have these little briefs about like what's important at your school, what's unique here, what's a real challenge here, and we had to write those so that parents could understand them. So since my very first job as a PhD, I've been training college students how to write to other audiences. I really appreciated today's talk. As a community sociologist, I have always done community engaged research where the questions I'm answering come to me from the community. The community says, we have a problem and help us understand it. So we were working with one middle school, and we had seen that their rates of tobacco and alcohol consumption were higher than any of the other middle schools. And because my partners in prevention and our marketing guy, who's like a youth marketing expert, we're a team of 4 of us, a nonprofit, the prevention coordinator at the district, me, the data analyst, and our marketing person. We went and had focus groups with these kids, and we told them what we wanted to do, and we wanted to use these community-based participatory methods, and the kids said to us, that's all great that you guys are worried about our tobacco and alcohol use, but that's not our problem. Our problem is rumor spreading. Kids are so mean to each other. We're being bullied, we don't come to class, whatever. And so we were really committed to these methods. And we're like, all right, our kids are telling us that this is not the problem. Let's use these methods for rumor spreading. And so we asked the students, to talk to us, and we followed all of the steps. The first things, the graphics that we created, the kids were like, these are not believable graphics. I don't believe the numbers. And we're like, why not? And they're like, I don't know who that kid is. And it was just a picture of a generic kid from photo stock or whatever, because there's this risk if you put real kids from your community and then they're caught doing the bad behavior, then your whole campaign tanks. So you need kids that look recognizable or whatever. And I was like, Ray, they say these pictures aren't believable, you've got to change the image. So Ray took some other pictures of kids that looked less relatable to me. And what he did, so the girl was in like her little horn-rimmed glasses and she was talking on the phone. Ray took this image of the woman and then he snipped it apart. You know how like if you were making a collage with something and he like blew her head up and like shrank her hands down and like changed her body size as though the picture were a collage. And we took those back and I was like, Ray, I don't know what you're doing, but I'm gonna trust you because you say you're the youth marketing expert. We've committed to not using any real kids. I think this is a stupid picture, but I remember I'm not the audience whose behavior I'm trying to change. So I'm gonna take it back to the kids and see what they say. And they looked at these pictures and they loved them. And I was like, please explain to me why you love this. And they said, well, she's not supposed to be real. She's obviously a character. And I was like, okay, youth marketing expert Ray with the giant red streak in your hair. Obviously you know what you're doing. So we absolutely did reduce rumor spreading in that school. But speaking about impact, we didn't know what data we should have been gathering to measure impact. Now, being the data scientist, research methodologist, designer that I am, right, I can carefully design, pre and post surveys, we had measured them, we had focus groups, we had all the things, we had qualitative, we had quantitative, we had before and after measurements, we had comparisons to other schools. And none of that is the data that really mattered. The data that mattered in the end is that the school counselor, who was my partner and did this whole project with me from start to finish, soup to nuts. At the end, after we'd done this campaign, Bill said to me, Jenny, you know what happened? I have more time to do my job. And I said, please explain, Bill. And he said, well, I used to have anywhere from 2 to 6 kids in my office every day, upset about bullying. And now maybe I see 2 a week. And I said, Bill, did you ever write that down? Did you ever keep a log of how many kids were in your office for what? And he said, no. So all I have is an anecdotal, impactful story. I mean, I have statistics and I publish them in the Journal of Professional School Counseling, but it's not the impact that we wanted. So my big aha always in community engaged research is that we almost never really know what the impact is going to be. And all of our best planning, can get us there, but not always. Yeah.
No, so I love this because we're thinking about, community engagement in our work. We're thinking about effective communication in our science. Can you think, for instance, Stephanie, in your work, and you're listening to the other examples as well, how engagement and communication connect, either in terms of learning how to better communicate within the community or learning how to better communicate impact, or anything that comes to mind within your CTSA?
So one of the things that we did as part of our RCMI program in health disparities, I'm on 2 different community engaged research groups, one with the CTSA and one with our RCMI program. And so one of the way that we share, disseminate research findings to non-academic audiences, we've done it in a few ways. We've done town halls, but one of the things is we did radio listening sessions, and we recorded the session. So it was a basic scientist sharing his research, not results, just here's what we're doing, trying to increase the perception in the community around what is the value of the research that's happening at Meharry Medical College. We know you all are there, these white coats on, and we have mostly bench researchers. There's probably about 5 community engaged researchers, and I'm one of them. And so we're really known for the kind of really big science, right? And so what we're trying to do is, as part of our community engaged research efforts, we're trying to elevate the perception of the value of research. So what does it have to do with anything that's happening in the real world? So he's a basic scientist as Alzheimer's research, right? Mm-hmm. And so we did a radio listening session. We have a HBCU, Fisk University is next to us. They already had a radio station. And so let's just try a radio listening session. We put him on the radio. We gave people opportunity to call in. He wasn't sharing research, just how he described in a very lay way his very basic science research. And so we recorded that session and then played the session back to folks, and we did some pre and post. And one of the things that we found about, one of the questions we asked was about, is hearing this change anything, the way you feel about research? And so we published it. So there was an increase in trust in research as a result of that. So that was one of the most important findings from that. And so one of the things, and it made sense, because what we hear all the time when we talk to folks about trust is it's like, you do this research, we never get anything back, you helicopter in, we don't know what you guys are doing. So just hearing, even though these weren't even results, right? Just, oh, you guys are doing, I know someone with Alzheimer's. I can see how, even though this work is in the lab, we help them to try to explain how it impacts something in the community. Because even if any researcher has an NIH grant, most of them, right? What do they have to write? A public health impact statement. I don't care how basic it is. You have to tie that something to humans.
Yeah.
And so when they say that, well, my work doesn't, resonate with the community, we just say start there. Mm-hmm. And so we've kind of created, so what we do a lot is creating templates for basic scientists to kind of use for lay presentations, but they work with us. So they're another group that help us, like, so we pilot tested our template for basic scientists, right? It's like, here's what we think you guys should, this is how we think you should present your very, very scientific research. And we had some of them to look at that, use it, and we've tweaked it a little bit, but I think that's the way we've kind of try to use it. We're doing a lot of, lay abstracts, radio town hall, Facebook Lives. We're trying all these different ways to reach different audiences, and trying to look at, kind of the results of those. In this way, it's the impact. So sometimes it's not always, this big public health impact, but we're kind of along this path. Like, what are we doing to change people's perceptions about research? The engagement piece is, we always say that if community has been engaged, one of the key pieces of evidence is something changed. And how do you track that? Someone asked us this, well, how did you track what changed, right? As a result of getting community's impact on this research. And so sometimes, if there's not a change, then why not? So we kind of go back. I don't know if I answered your question.
No, that's wonderful. Thanks. We have Heather over here who leads so much of our communication and thinking about how can you help people think about, how to frame some of that. How can you frame public health impact? How can you communicate that effectively? Is there anyone in the room that works with Juntos in terms of our Juntos Center for Advancing Latino Health has worked with Frontiers. I think has done some really nice work with radio and podcasting in terms of communicating science to the community. But I don't know if there's other examples in terms of that communication that you guys think of.
Yeah, I have a great example that doesn't really fall into that category.
That's okay.
But it works with both of these issues, the images part and the how are you communicating, not necessarily to the community so much as to audiences that wouldn't otherwise pay attention.
Right.
So back to this story of the thing that measures sickle cell, or that detects sickle cell in babies. This guy's an engineer, right? Nobody teaches engineers how to talk to the community or anybody, right? And they're not artists, right? So what he did, we're fortunate in Cleveland that we have an art institute that's right next to Case Western Reserve University, the Cleveland Institute of Art. They're known for medical communication. So he hired one of the artists out of CIA, it's known as, he hired one of those to help illustrate his device. And she did a beautiful job. Basically all you see in the image is a hand, an African-American hand, in this case African, because we're talking about Africa for the most part, and then a little finger stick, and the blood cells kind of shoot out of the picture at you. I mean, it's really compelling. And it also shows his device and everything, but that's the part people pay attention to is the hand and the blood cells. And there's some sickled cells in there, obviously. That image, he wanted it to be an illustration in one of his papers. But the journal that published his paper wanted it on the cover.
Oh, wow.
So it became the cover image. And once it was the cover image, suddenly his research took off because everybody everywhere wanted him to talk to them, especially the public health people and the people who are interested in studying tropical diseases, and the people, just everybody wanted to have him come talk to them. Wow. And here he is, an engineer, right? Yeah. Awesome. So that art is what made the difference. So it made me think of your picture.
Yeah, I want to talk a little bit more about that about how we communicate and how important that is. Like I said, I've spent my whole career doing community engaged work and been trained early on how to communicate to others. And so, some of the work that I did was actually on energy conservation in buildings. And there's lots of public health benefits of that, people aren't doing it for public health, they're doing it for dollar savings, or whatever. But one of the things that I discovered in the research that I was doing is that the key players in energy conservation building are custodians, because they're the people that understand and know buildings the most. And so when people asked me, my school district, after I'd done a bunch of good work, actually this rumor spreading, the facilities manager talked to Bill, my counselor friend, and said, hey, one of our high schools saved 50% of its energy, and we don't know how. can you help us find out why? And he was talking to Bill, who was trying to put a wind tower at the school, and Bill was like, oh yeah, I know the woman, Jenny, she'll help you. So I came and I helped them. And as I discovered what they'd done, I said, Bill, you know, this energy conservation is what you and your team did, right? And he's like, no, I didn't know that. Like, all right, well, I have all this data, you know, focus groups and site visits and, you know, mixed methods, sociology, whatever. We discovered that that the story was what facilities and custodians are doing, as well as, you know, behavior change and other stuff. So then we started talking about it. So the first reports I gave back to them, and it took, of course, you know, years for the academic publications to make it through, but we had been doing these public presentations that were me, and Bill and Stu to public audiences and especially to facilities folks. And then as soon as the first paper got published, which was like 3 years later after the first research got done, then Colorado Public Radio, you know, heard about it and did a public radio story. And then at that point, then it just spread like wildfire through the state, that the state of Colorado was interested, you know, businesses were interested. And the thing that was compelling to people is that I was telling the stories of custodians, some of the people who are the most unobserved in buildings and what their role is in social transformation. And so that one is such a great example of how we were telling the story a lot first, but the academic publication, once we had that behind us as like the backstop, the proof, right? Then more media outlets were interested and more people, you know, wanted to tell the story. So I've always felt like we have to be telling those stories in all of the venues all the way along.
So when I think about social change, I think about influencers, you know, the social media influencers, and sometimes it's very surprising that they can influence so many people without any data, whereas we are unable to influence people despite all this data.
Yeah.
So I guess it goes back to communication. We are not communicating effectively. We put our manuscripts in these big journals with all this language, which nobody really understands. What's a good solution to that? Like, what do we do? And I think that's a major barrier. And then we are also fighting this misinformation, which is out there, but we're already like slow because we haven't even conveyed our information. And then the next step is fighting the misinformation. So I don't know, any insight?
I think of this a potential solution, but there's a problem. So I was contacted after our first paper about the protocol paper of how to do a translation science case study. Protocol papers are not really compelling reading. So do this, do this, do this, do this, right? And they're like the rigor, all that junk. And it's basically not very compelling reading. But this organization out of England contacted me and said, maybe this was one of those draft letters that they sent to everybody, but they sent me this email and they were really interested in this paper, and we'd love to do a podcast on it, or they called it an audio pod. So the one version is an audio pod and the next one has some visuals with it. The problem with that, the hurdle with that, I thought that was a very cool idea to get the word out to non-scientists, is that I had to pay for it. Yeah. Right? Evaluators don't get a lot of grant money to do evaluation, right? We're internal evaluators. We're usually paid by the grant. So I had to go to my powers that be and say, can I have money to do this audio pod? And then in the end, the audio pod probably didn't speak to anybody except the people who subscribed to the audio pod, right? But I think that's getting there. Right? Yeah. It's getting closer to the influencers. It's not the influencers though. There needs to be a bridge somewhere between that and the influencers. And the money can't all come from us, the researchers.
Right, yeah, right. Yeah. Something that I've experienced, I was a research coordinator on a community-based research study for a few years that was looking at COVID-19 testing in school districts and how we can allow our kids to be tested and have schools not be shut down. This was in the peak of quarantine. One of the major barriers that we encountered was actually during more of like the consent process for anyone that doesn't speak English, and understanding how we can effectively make sure that, okay, they're providing a verbal assent, we had a waiver of written informed consent. So how do we make sure they're actually understanding what they're signing up for when they're only seeing the benefit of, well, I'm signing up for this because I want my kid to get tested at school today before they go home. And then we spent probably 9 months developing a digital consent video with the NIH and tried to put it on YouTube, and we never used it a single time with a single person, because by the time that it was actually done and in production, we had no need for it. Everyone was already signed up for that school year. I'm just curious if you guys have any experience with those types of barriers or how you've kind of gone around them in your research.
I think the barrier around, so just in general with like consent, so we have at Mahara, we have a Center for Translational Research License. So all of their teams have like bilingual personnel on their staff. And so for that group, everyone who's sitting there, they have someone who can translate. And so when they're reaching out, they do vary for their research projects, they do very specific marketing. So everything, they have Spanish recruitment material, so they kind of, because they're staffed for that.
Right.
And so I think that's probably what's helped them, right? And so we know the demographic that they're reaching out, so they're just staffed and ready to do that, and they have all the materials in different languages. If someone is interested, they will not consent them without the translator there, because they want to make sure that people really do understand. So if that person is not there today, you gotta wait till they're there, because we want to make sure. So this is not my team, but this is our CTRC. So that's what they do. That's part of their standard practice, to make sure that they're staffed up for that.
I mean, I think that's what we do.
Yeah.
I mean, I think about the dementia study that I did and how much time and energy we spent on, training the student staff to consent people. I think about the work that we did related to the SEAL project, which is the COVID equity. I don't know what the acronym stands for. We were, really thinking about equity and access during COVID. And in Colorado, right, we've got some really big pockets of immigrant groups. And so some communities that have really large proportions of non-English speaking folks. And so all of that was really just about training and staffing up, both for all of the people doing outreach and engagement and all of the people doing consenting. And so all of that, kind of really building that capacity, is something that we do through the community engagement core at our CTSA. I think one of the things that is super interesting, this is not quite off gears, but like thinking about what knowledge can we share broadly that's useful to other people. Our community engagement core has this really fantastic relationship with a nonprofit in Denver called the Trailhead Institute. And so for all of our engagement efforts where we need to pay people, $60 to participate in something like for an hour focus group, or they're going to have their participation in a project for engagement is going to be like 5 sessions or 12 or whatever. We just have this nonprofit that we partner with. And so all community payments and engagements just go through them, right? So I lump sum on all of my awards where I know that if I'm going to be paying, 10 people for 12 hours or 100 people for 5, whatever it is, right? I just lump sum payment then, and then they handle that. So that's, some of our barriers to really good engagement or outreach or whatever are thinking about how to, like, our universities struggle with payments, and having a strategic alliance with a nonprofit helps us overcome that.
Talking about consent. While consent is needed, if you are trying an investigational drug and we don't know what the side effects are and things like that, but then some of the other elements like just teaching, or coaching, and maybe having a community health worker assist with something, they're simpler studies. And then I've often wondered about all these regulatory, I call them barriers, but they are there for a purpose. But the consent itself, the document looks so big for a small little intervention that it's almost scary.
Absolutely.
And I feel it really drives people away from the study. So I don't know if you want to talk about these regulatory barriers, or things which can be perceived as barriers?
I have a funny story about that. We've been doing these case studies. We recently have been focusing on people who've translated something in and have had a health equity or a public health impact. And we found an investigator who happens to be an endocrinologist, who's invented a device, and it's already being produced, it's out there, and we wanted to interview him, right? And so we, in order to interview him and use those interview notes or recordings, or even to use his name in our publication, we have to get consent. So all the other researchers we've done, no problem. This guy, I only ever communicated with him by email. I just said, you know, we need you to sign this consent form and we need to interview you. And he's like, I'm too busy for that. I don't have time for an interview. And we're like, oh, we really want to tell your story. And he eventually did sign the consent form. It was all electronic, fortunately, so it was fairly fast for him. But he still wouldn't be interviewed. So we're thinking, well, the only way we can use his information is if we get some key pieces of information from him. So we started sending him one email question. And we get an answer sometimes. Like, send him one more, you get an answer. And I thought, this is really not what I call interview rigor, but at least it allows us to use his data, so. Sometimes.
Tell him when you would email him, like, this is our next question for the interview, or would you just ask him like you're?
No, I didn't even bother anymore, because he'd already brushed us off as I'm too busy to do an interview. So if he thought it was an interview question, he'd say no.
Right.
So I just made it sound like, by the way, we need to know this.
I would like to say, most of the consent forms, if it's 20 pages, usually you could get it down to probably half. And
Yeah.
so there's just too much
Yeah.
terminology in there. And so one of the things that, and so our institution does a lot of industry trials and they send the consent form to them and we try to tell them, look, can we just let some community folks look at them? So we have something called Community Engagement Studio. So we're about to start this
Good.
really kind of genomics research study at Harry. And so we knew the consent form when they sent it to us. It was like, this is too, let's just take it to the studio. So the studios have community, what we call them experts. And you can take any piece of research that you want to hear about, like if it's you're at the design stage, or we have these surveys or all these things to get feedback, either before we send it to the IRB or maybe even after, you know, an amendment, right? And so this one consent form, it was just like, we told them, you know, even, you know, it's too long. So we went to studios and they just tore it apart and all these things. So it was probably 14 pages. It was not at even sixth grade. It was like college level. So we went through and all those things. And so it's probably down to about 6. But what one of the suggestions was from a community member, and I've seen other studies that do this. So there's the first page, you know, how all the sections you have to have in the consent form, you know, the benefits. Hit on everything on the first page and then put on the page number where you can explain other things. Here's the summary of everything. But if you want to know more, go to page, it better not be 25. Still, we're trying to keep it short, right? But it's like, because especially even if you have a research coordinator going through, if you're doing digital consent where people are doing it, you know, online, all those things, you might lose people. So try to hit the high points on the first page as much as you can, and then maybe refer, so people know if I'm really not getting this, or I really want to know more, I can go to this page if I want. So that was a good suggestion that, but most of the time they can be cut way down. And in these days, I've had a researcher, he's like, you know, I'm just using ChatGPT to help me with my language, to bring it down, putting the whole, you know, so.
That's a good use of chat.
Yeah.
Take this document and translate it to 6th grade level.
Now, the IRB was okay with all the summaries on the first page.
Yeah.
Oh, that's good.
So and we're really, as long as it has the information somewhere, and we encourage all of our researchers to put something in there. Here's the surveys, because they need to get it in. Most of the time, I need to get my study approved, but put in there that you're going to be working with the community engagement board to refine your document. So you may come back with something different, but and amend it. So they're getting used to hearing these things and they understand we're trying to do the right thing here. So the IRB, we have people on the IRB now, investigators who kind of understand. So we probably have some advocates on the IRB as well. And we have community members on our IRB as well. So but probably like most folks. So.
We established a new protocol for community engaged research that has different expectations. So rather than having all of the documents, planned ahead of time, if you're doing really genuine community engaged research, right, it starts with what are the community agreements and, the relationships.
Right.
And then that's only the first thing that goes in. So we say, we're not asking you to prove everything. We're not even gonna do data collection until year 2. So in year 1, we want you to be viewing just our community agreements. And then you're gonna be, then we'll be adding, these other documents so that we build the protocol over time with our IRB rather than thinking that they're gonna have everything ahead of time. Because I just tell them, I'm not wasting your time or anybody's time reviewing a questionnaire that hasn't been vetted by the community. So we just did a few of us who do community engaged research just had kind of a presentation and a working session with the IRB committee. We got invited and then we talked to them about why we need them to review these protocols differently and why we need them to sign the letter, that allows us to start. Because I assume most universities are like this, right? Can't receive the money if your stuff isn't through IRB. So so IRB just has a different tick box for what kind of a protocol is this, right? It's a community engagement protocol. And so then the first approval that they need is just that basic, overview about what our engagement structure is and what our first community agreements are. And then they'll sign off that lets us receive the money and stuff. So we actually created a whole new kind of organizational structure for that with our IRB.
That's great.
Yeah.
That's really good.
You can read a little bit about that in a publication that I wrote in 2014. If you Google my name and IRB and community engaged research, pop right up.
Well, that's why I think that some of the process publications, while they're not necessarily the most exciting of all the publications, having it out there helps other groups do the work and not have to reinvent the wheel that you've already created, or at least here's a model. I can cite that when I'm explaining to my IRB why we should do it this way, or I can work with our current community advisory board to say, hey, what could we do that might look like this and who might be interested and that sort of thing. Now, I know we have 5 minutes left. I could talk around for about
a question here.
I was gonna ask for questions, yeah.
I just have a quick question. So I've been working in public health and I'm kind of new to research. So I've part of this group that we're trying to figure out how to involve community experts in the project design aspect of it. And so it's /research and an actual program for mental health. So I would love to hear your thoughts, how to do it right.
I want to talk about this. So one of my most recent projects was working with people to take people with dementia and their caregivers to the symphony with the intention of improving the cognitive function of people with dementia, improving the quality of the relationship between people with dementia and their caregivers. So these are people with dementia still living at home. And then the fourth is to increase the level of support that the care partners experience, because people caring for a partner with dementia, their health takes a big plummet. So that is a project that the community actually designed the intervention. And then because I had this reputation in the community, they came to me and they said, hey, Jenny, we want to do evaluation and assessment. We want to measure the impact that we're having. And so they came to me and I said, yep, this is a question that deserves to be answered. Yes, sociology can help you. It took me a long time to actually recruit the other scientists to help, especially the neuropsychologists who would measure cognitive function. But because the community had started it, they were already a super high functioning group. And so we just called that group, the name of the program was called B Sharp, and it was the B Sharp Steering Committee. So that committee met.
I love good names.
So the B Sharp Steering Committee, they met every week. And not every week, they met once a month. And every month, I was the only researcher present. And I kept trying to bring other researchers with me. And my research team kept saying, no, Jenny, that's not our job. You can translate whatever we're doing and get the community approval and interest. And I said, okay. And the community group appreciated it too. But everybody who was on the steering committee had a formal role in the design, creation, implementation of the intervention. And so every month they met to debrief what happened last month, how's it going? What's the feedback we're hearing from participants? How's the research protocol going? What pivots and adjustments do we need to make? So that steering committee, I was just one of 8 people that was designing the program and implementing it. And then it was my job to just be the translator back to the research team, the people that were picking the instruments that we're using, how long they were going to take. And that group was giving us feedback all of the time about it. So I think that that matches, you know, really what the keynote speaker was talking about earlier today, is the principle for community-based research is that the community partners are deeply involved, like fully integrated from the very beginning all the way through. And that's just a really nice example of research that started with the community. They always maintained control over it. They approved all of the grant making that we did. We had 3 fundraising arms, one for the tickets to pay for the participants to be, another one that paid for the other logistical support that needed to happen, like receptions and stuff, and then stuff for research. And so we had a really kind of broad-based coalition, and each member of the steering committee had a particular, you know, investment and role in investing it. And then the group took responsibility for, you know, assessing how is it moving and changing, you know, over time, and how do we guide it as it were.
So fantastic. That's a great example.
Yeah.
We have time for one more question. And, you know, we definitely encourage you to engage with our panelists afterwards, but if there's one more question, we could do that. A final question, Ndidi? Or
Sure, yeah. So I guess if you're selecting some members of your community advisory board or governance board or whatever you want to call it, I guess, what are you looking for in those members? Because in the community, we have people from all different educational backgrounds, different roles. I mean, so what exactly are you looking for? You know, trying to kind of go back to your question, how do you select people and how do you start?
I would specifically to your question, so you have there's a target group you're looking for, right? So there's a specific, so like when we're working with researchers for community engagement studios, we work with them on developing materials to reach out for those people. So if you're looking for caregivers or people who live with HIV, your marketing materials are gonna say, we're looking for people who are caregivers for people with HIV, and we wanna hear what you have to say about this research. You really just say what you want.
Yeah.
You know, you're very conversational about it, and you gotta get it in the right audiences. Maybe there's networking with, you know, some HIV nonprofits or whatever, but you just say exactly what you want. We wanna hear from people. It's because you're right, because this right, the part you're doing there, that's not necessarily research. You're trying to help design the best research, and you wanna hear from folks. So that's how we work with researchers to create their marketing. Some of them use flyers, some people may put it on social media.
Yeah.
But we just say, who are we looking for? Just like I said, very conversationally, we wanna hear from kids 12 to 15, and we wanna talk to you about bullying.
And when we do that too, and then we help people identify who are the networks, how do you find
Yeah.
them, right?
Yes.
Who is connected, right? So like if we're thinking about kids, right, we have, you know, some youth resource centers, like in Denver, Colorado, we have a particular, you know, LGBTQ resource center, and that's where we would, you know, do that dissemination. And if it didn't work, then we would go to that center and we would say, our reach out is not working, and we would have them help ideate with us. We would just host an hour-long session where we have them brainstorm with us, what is the network of people that, you know, are in this population? What does their network look like? And help us think about how do we reach out to them differently? And usually we're not using the right media, you know, whatever. And so sometimes we have to workshop ourselves.
I have a very cool finishing story that goes with that network of people that you want to get to. They can be really, really powerful when it comes to getting drugs or other sort of therapies out there in the real world. I have done several of these interviews for case studies, and one that I didn't do, but someone else did, is the story of Gleevec. If you don't know about Gleevec, it treats chronic myelogenous leukemia. Gleevec was shelved by the pharmaceutical that was developing it. They didn't think it was powerful enough. They didn't think there was enough people with CML out there. They shelved it. the families of people, of relatives who had CML. Basically, I mean, this was like even before the internet, but they screamed bloody murder. It's, you cannot shelve this drug. Because the initial trials actually showed it worked great. But the company didn't think they'd make enough money. But the advocates, meaning the family members, people who have it, basically got them to put it back on and do some more trials. And it basically cures people with CML. It's a miracle drug.
Probably a loaded question, but do you know how they succeeded in that? I feel like there's a lot of topics like that going on in the world right now where communities are screaming, please don't do this, but that's not, the outcome isn't happening.
Now we've got the internet, so like it's way more powerful. All you have to do is get a couple YouTubers on there and man, you're golden, right?
And someone has to listen.
Yeah, they didn't even have that back then. I don't know how they did it. I've been pushing very hard for this story to be part of our case study cross-analysis. But it goes back a little too far and the people who are really involved are not around anymore, or not available for interviews. And so we're working second-hand information and that's just not great.
It's just kind of a promising story that someone was able to convince a pharmaceutical company to not do something because of their bottom line.
Yeah, and it wasn't one person, it was hundreds.
It's a lot of,
Right.
that's what it is,
Yeah.
it's an organized.
It was just grassroots sort of a thing that had to
They
happen.
just thought that maybe they will make the money because there's so many people for it.
Right, I mean, they didn't understand what the market was.
Yeah, the pharmaceutical only looked at it from the financial standpoint, and the families
Yeah.
said, wait a second, you're missing the biggest part of the story.
Which is keeping people alive.
I would say thank you so much because giving us these examples from your experiences at your CTSIs, I think whether we're talking about community engagement, whether we're talking about communication, we're talking about people coming together, people connecting and being able to do bigger things than they would be able to do themselves with greater impact. And that take-home message hopefully includes the idea that Frontiers is here to do that as well. So the more that we can get individuals from different institutions, different backgrounds, different expertise, different stages of their career and community members together to make these connections, we can do great things, we can have greater impact, and we can help translate science to the health of the community. And so we encourage you guys to help get other individuals that you're working with to get involved, because then when we have a question, we don't know what to do, we can come to Frontiers Resources. And if Frontiers doesn't have the answer, we can go to our CTSI colleagues elsewhere and really helping answer questions and have big impact. So thank you so much. Thank you for being with us today.